Suffering from shoulder and neck pain, very severe. I went to emergency room one time, and all they did was give me a shot and some pain medication. Told me just to put some ice on and go away. You know, and I went to a neck and back specialist for a little while. Took an MRI, got no answers there. For 2 years, I went to physical therapy. I did acupuncture. I went to a chiropractor. I mean, you pretty much said I did it all. I hit the door. He did a few simple tests, some tests. I took x-rays and photos and some sound tests of my jaw. He did some simple movement tests to see how I'd react, and then he said I had TMJ. I was suffering from TMJ. I was a little skeptical at first. I didn't think it would work. I didn't think how my jaw would affect my neck and my back and all this pressure in the back of my head. But at that point, I really didn't care, so I just wanted to come in and try it. So it was worth a shot. At that point, I was willing to do anything.
What we're going to do is we're going to orthopedically correct that. We're going to make something to bite on that you're going to correct that bite.
He put a little splint in my mouth, and this ortho splint I put in my mouth, and it kind of just moved my jaw, set it correct a little. It set my jaw correct, and all of a sudden I felt better. It was almost instant. Like my neck pain started minimizing. Started going away. I felt the pressure from the back of my head instantly go away, and I knew it was working. I've been a patient less than a year, about 8 months. I feel great now. You know, I'm starting to go back to the gym like I used to, taking care of myself physically, and I'm able to concentrate. I go to school too part-time, so I'm able to sit there and concentrate like I never was before. I'm able to focus better. I was just really excited that it actually worked for once in my life.
I've always had headaches in my temple that I associated with stress headaches and other things associated with it. And when I came to Dr. Hernandez, he checked me for the TMJ, and he said that was probably associated with my headaches. So as soon as I was fitted with my bite splints, my day splint and my evening splint, I noticed an immediate improvement. My headaches were gone within a few weeks.
One of the basic things that we use is a splint or an orthotic device. Well, I guess the way that everybody can take a look at that is it's very similar to what a night guard looks like, or a mouth guard. But it's a lot more sophisticated than making a piece of plastic on top of your teeth. And then at night, it's a whole different process because your nervous system changes at night. It shuts down. It's on automatic pilot. So other types of situations are involved with that. So you need to make a device for that so that way the patient can relax at night.
I'm amazed at how well I feel. Just amazed at how fast it could work too.
I've been amazed at the treatment where we've seen patients really turn around in 24 hours. But everybody's different. It may take months to see that correction turn around. You can make a diagnosis from just a clinical examination on that, but I don't think you're going to be very accurate. We use a variety of instrumentation here. We use a joint vibrational analysis, which the more noise that a joint makes, the more sick it is. The most accurate device out right now is using a CAT scan, which is what we have in our office right now. There may be practitioners out there that everybody that comes to their office that they're going to treat, and they're going to treat with a TMJ treatment, and that might not be the right thing to do. The thing that I'm going to do is that I'm going to make an examination for that patient, and I'm going to see what's going on with them and make that determination as to whether is that the number one problem that their nervous system is calculating. You know, I know somebody very, very close to me that has this problem. A completely broken down jaw on the left side, and it's me. You know, I went through this treatment. I'm wearing a splint right now in my mouth. I couldn't hold my head up. My head hurt so much that it hurt to work. And I really came to a point where I thought, am I going to have to give up my career because of this pain that I'm going through? And I just had these nagging, persistent headaches that really knocked me out. And it was a problem. And so, after seeking out treatment, I'm in class and I'm going through my manual and I'm looking at all these things that are being presented to me, and I'm saying, that's me, this is what I've got.
And you don't even realize that it has to do with your bite, with your jaw, and it affects your whole body because it could misalign your whole body, your whole back. I'm just amazed at how well I feel. I no longer have headaches in my temples at all. Never. I haven't had one headache there ever since I came here. Not one. And I always thought it was just stress. And it wasn't stress. Because I still have stress.
It was wonderful. I had very, very bad experiences at a dentist at a young age. When I finally did get my teeth worked on, 2 weeks straight in a row, very, very, very bad experience. Dr. Hernandez, now I love coming here. I have no fear at all. In fact, I look forward to it.
He's very gentle. He lets you know when he's going to do whatever procedure. And I've never really been uncomfortable as far as pain.
From my perspective, as far as pain, that's not really an issue in today's dentistry. If you take care of things properly, deal with infection, take care of the patient in those proper order, you're not going to deal with pain with dental procedures. It's just not happening. The dentist can clean your teeth. Most offices have a registered dental hygienist that is licensed in the state of California to clean your teeth, and he or she is up on the latest things because that's a specialty of dentistry in its own right, I think. And that is, as long as you are up on your education, there's new things coming across that they're finding all the time, that the mouth has this, the mouth has that, these germs have these things, this bacteria is now resistant to antibiotics. The hygienist is up on that, and they're a specialty, like I said, in their own right. That's the person that you need to see on a regular basis as well.
I've been a patient of Dr. Hernandez for 12 years. And the reason I keep coming back is because he is not only a dentist, but he treats you like a friend that he really cares about, takes an interest in you and your family. And personally and professionally, he just has a very nice atmosphere in his office.